This discussion will focus on looking at different terminologies that nursing pharmacology use, so you'll be able to understand it better, the mechanism of action. So let's start with understanding SNS versus PNS effect. So with SNS in here, you'll see that it can dilate pupils, inhibit salivation, increase heartbeat, and when you summarizes it, it increases the size of the pupil, right? So it's pupil dilation. It increases heart rate. It increases respiratory rate, blood pressure. When you look at the level of consciousness, it is hyper LOC. What do I mean by that? Like, for example, restless, agitated. And when you look at going down here, when it comes to the stomach, right, there will be decreased GI activity. Okay, decrease GU activity because of vasoconstriction. So your patient's tendency is to become, what if there's decreased activity, there will be the constipation, and also patients will have decreased urine output. But remember, there are some exceptions. Like, for example, when you're giving antipsychotic drugs, it might be a different effect to the patient. So again, when it comes to GNGU, it might be, individualized. So you have to look at your patient, because sometimes, even though there's decreased activity due to SNS, some patients' reaction for it would be diarrhea instead of constipation. So you just have to be mindful of that. Now, when it comes to parasympathetic nervous system effect, it will be the opposite. So decreased size of pupil. So your patient will have pupil constriction, with salivation, it's stimulated, slow heartbeat, low blood pressure, low respiratory rate. And also be mindful when it comes to parasympathetic, the airways are constricted, while for sympathetic, it's relaxed airway. Now when you look at the GI activity, your patient will have the opposite. So increase GI activity, increase GU activity. So again, be mindful when it comes to GI and GU. Now, as we discuss the effects of parasympathetic versus sympathetic, you also have to be familiar of the terminologies that pharmacology uses, so that if you see the category of the drug or the class of the drug, you'll know already what the mechanism of action is of that drug. Like, for example, for PNS, parasympathetic nervous system, other name of that is cholinergic, because if PNS is activated, acetylcholine is released. Okay, acetylcholine is released. While for SNS, the other name of that is adrenergic. Why adrenergic? Because with SNS, catecholamines are released. And what are these catecholamines? We have norepi, we have epi, we have dopamine. And another thing you have to take note of is with SNS, your patient also, the drug can also be called as sympathomimetic. So if you see this as a class of drug, you already know that this drug has SNS effect because it mimics the sympathetic nervous system effect. Another name of it would be parasympatholytic. And lytic from the word lysis, or breaks. It's like it breaks the parasympathetic nervous system effect, which leads into SNS effect. While for PNS, would be parasympatholytic. mimetic or sympatolytic, right? So when you look at it very closely, if PNS is cholinergic, then SNS is anti-cholinergic. So by looking at it very closely, you already know that any drugs that have a classification of the following, the effect would be PNS. Any drug that have the classification of the following, the effect would be SNS. I'm going to give you an example. For example, dopamine. Let's say you're giving dopamine to a patient and it's a beta-1 adrenergic medication. Then you know that it can increase the heart rate of your patient. I said beta-1 because it's cardio-specific drug, right? Now, since we're talking about these different terminologies, another thing you have to understand is that a lot of drugs can use alpha-1, alpha-2, beta-1, beta-2, whether it's adrenergic or a blocker, okay? So let's move on to that. So let's see. Okay, so where does alpha-1 and alpha-2, beta-1, beta-2 came from? Where did it came from? So let's review. Remember that in nervous system, you've learned that in nervous system there is central and there is peripheral, right? And in this central there is brain and there is spinal cord. And in peripheral there is somatic and there is autonomic. Now, in autonomic, it's divided into parasympathetic nervous system and sympathetic nervous system. Now, in sympathetic nervous system, this is where the alpha 1 and alpha 2 came from, and beta 1 and beta 2. So as you can see, it is SNS, right? Now, we cleared that out. Now, where is alpha 1 and alpha 2 exactly located? Remember that alpha 1 and alpha 2 are differentiated by their location relation to the nerves. So like for example, alpha 1 adrenergic receptors, they are located on postsynaptic effector cells. Okay, alpha 1 located in the postsynaptic effector cells like tissue, muscle, or organ. Okay, while with alpha 2, it's in the presynaptic nerve terminals. So remember that with alpha, adrenergic agonist, I would say adrenergic agonist because they are under SNS, they can vasoconstrict and can cause CNS stimulation. Right? So these two vasoconstrict and can cause CNS stimulation. And you've learned so many ophthalmic drugs that are under alpha adrenergic agonist, right? Now I added adrenergic because it's under SNS. Now, what is beta 1 and beta 2? Now, beta adrenergic receptors, beta 1, is primarily located in the heart. So this is cardiac. While beta 2 are located in the smooth muscle fibers of the bronchioles, arterioles, and visceral organs. So lungs and visceral organs. Now, going back, there are a lot of drugs that are beta 1 adrenergic, right? Like as I said earlier, the dopamine is a beta 1 adrenergic drug. Dobutamine, right? They are beta 1. It's beta 1. What else? Epinephrine. It has an alpha and beta adrenergic effects. Midodrine is also another one because it's for orthostatic hypotension. Now for beta 2, the meds that are under beta 2 adrenergic agonists. Now the question is, what would be the effect in the lungs? The effect would be to relax the airways, right? And we have a lot of beta 2. Like for example, beta agonists would be albuterol, right? And it's a bronchodilator, but it's a beta 2 adrenergic agonist drug. What else? Epinephrine. Epinephrine IM is also a beta adrenergic drug, and it's used for anaphylactic shock or allergic reaction, and we give it via IM. So as you can see, by knowing these terminologies, SNS, PNS, alpha 1, alpha 2, beta 1, beta 2, you already know what the mechanism of action of the drug that is given to you under that classification. So I hope this helps to debunk the myths in nursing pharmacology.